Well, hello everyone. I'm Chris Mahan. I'm Jennifer Biggers, and we are doctoral students here at Forest Institute. And today we're presenting on grief. And we appreciate you guys taking part of your day to come spend with us today. So we've titled this Grief, a Personal Journey. We're going to cover a lot of different topics, but kind of highlighting that grief is very individual for every person. It's based on lots of different things, including our experiences and our culture, those type of things. We're going to talk about that a little bit too. So our objectives today, we're going to kind of introduce grief, provide you some definitions. We're going to talk about myths. There's a lot of myths out there about grief. We're going to talk about that and the various stages of grief. We're going to talk about the Loft Cycle. We're going to do a little activity with that. And then we're going to talk about the diversity in death, dying, and grief. We're going to talk about some interventions. Some of these are things that you can do in a therapeutic setting. Some of these are things you could do at home. And then kind of summarize, wrap it up, and answer any questions or get any feedback, comments from you guys.
Okay, so, we wanted to start out by giving you kind of a definition of grief that we had found and kind of felt like was fitting. And there have been different types of grief that have been identified, and so we also kind of wanted to talk about those. And so basically, overall, grief is an individual's emotional reaction to a significant loss. And we want to highlight the fact that when we say significant loss, it doesn't necessarily mean a death. It could be the loss of a job, or it could be the loss of some type of physical ability that you may have once had. And so it's any kind of loss. And then there's that process of grieving and bereavement, which is basically just your emotional and your adjustment and your life adjustment as you go through life after you lose something or someone. So. And then there are a couple types of grief, like I said. One of them is complicated grief, and basically this is just a period of really intense grieving and anxiety. You just can't seem to get past this grief, and it's complicated because it's just really intense, and there are a lot of very intense emotions followed along with that. And there are different factors that can influence and turn into complicated grief, basically. It can be like the characteristics of the bereaved person, maybe you were brought up a certain way, and kind of how you perceive the death, that may be how your reaction to that's going to complicate things sometimes. And then sometimes the nature of the relationship with the individual. Were you close with them, and it was just someone that maybe you feel like you lost a piece of yourself when they passed away? Or was it someone you weren't really that close to, and so there's all these feelings of guilt and kind of, in a weird way, maybe some relief in that, and kind of understanding that and feeling those different emotions. And then you have the circumstances of the death. Was this a prolonged illness that someone had to endure, or was it a sudden tragedy and, just really unexpected? That's also going to affect complicated grief in a lot of ways. And then we have unresolved grief. And basically this is a period of grief that lasts longer than is typical for an individual of their social circle or cultural background. And so it's very similar to complicated grief, except it's not as intense. It's almost like if I explain this right, it's like it's plateaued, and there's just always, for a long time, this sense of grieving. It can't seem to move past this, and it just lasts and lasts and lasts. And there are several things that can contribute to this. When you have those feelings you're not really sure of, like we talked about, kind of your interpretation of what happened and your perception of, were you close with that person, were you not, really unsure of your feelings. Maybe, you had low self-esteem and you have feelings of guilt and just a lot of negative emotions along with that. And then maybe the loss you felt like was a result of unfairness. You know, maybe somebody lost a job and they really felt like that was unfair based on, you know, discrimination or things like that. You know, I personally have had friends that have been in car accidents and they've lost the ability to walk, and so now they feel like it's really unfair. Why did that have to happen to me? And so that can sometimes turn into unresolved grief. And, you know, if you have a traumatic experience that is surrounding the loss, maybe it was a tragic car accident or whatever the case may be, you know, sometimes that can cause unresolved grief and just prohibit you, I guess, from moving forward and grieving. And so we also wanted to touch on some of the common symptoms. Now, keep in mind this is obviously not an exhaustive list. As we said, people are going to go through this in very different ways. And so, but some of the most common ones in terms of physical symptoms might be they have low energy, experience headaches, you get an upset stomach, maybe you have excessive sleep, or you have a lack of sleep, maybe you're malnutrition, or you overeat, however, you know, whatever the case may be. And then sometimes I know that, like, when people really sink into that grief and that depression, you can have hallucinations and illusions of the person that you lost. And so those are some of the physical symptoms. And then you have emotional symptoms also, like you have the memory gaps, become really distracted or preoccupied. There's some irritability there, some depression, and sometimes even euphoria for some people. And then you have the spiritual symptoms. For some people, they may feel closer to God, and they may, you know, look to God for comfort during that time. Or there are other people that may be angry with God, and they end up, you know, changing their belief or not believing in anything at all after that. So those are some of the common symptoms. And now we're going to talk about some of the common myths, and some of these you may have, you know, really thought about before. But the first one is we only grieve deaths, and I've touched on this already. You know, there are many kinds of losses we can experience, and so it's not only deaths that we grieve a lot of times. The second one is that all losses are the same. That's absolutely not true. You know, people experience loss in different ways, and so that process they go through is not going to be the same as the next person. There's not a book out there written that tells you exactly how to process grief, because you're going to experience it differently. The next one is it takes only 2 months to get over your grief. And again, you know, you have some of that unresolved grief. You know, that could last a long time for you. And so it's going to depend. And so the next one is that grieving means letting go of the one who died. You know, I think some people feel like if they're able to let go, then they've grieved that. And sometimes I think it's comforting to people to try to hang on to those memories and those things. And that's the way they grieve. So that's going to be different for some people. And the next one is that all bereaved people grieve in the same way. Again, not true. They have different experiences. And then it's the next slide. So then some more myths we came up with, our research, was that grief always declines over time. You know, when I was thinking about this, it reminds me of like when you get to birthdays or anniversaries of someone or something, you know, maybe an anniversary of a tragic accident or whatever, you know, maybe that grief is going to be heightened again and all those feelings are going to come back. And so it doesn't necessarily decline. It can kind of go up and down depending on the circumstances. Next one is that when grief is resolved, it never comes up again. And again, that goes back to there are going to be those times when things bring back memories. And so it's not going to ever sometimes be completely resolved. And then the next one is children grieve like adults. And I primarily worked with children, and I know that in working with them, I've seen a lot of them, they're not able to express what they're feeling. And, you know, they can't say it. And so you'll see more acting out behaviors and those kinds of things. And so they grieve completely differently. Sometimes they don't understand it. And then another one is expressing intense feelings is like losing control. You know, I think people sometimes feel that if they cry or they show any kind of emotion, then that makes them look like they have no control over themselves. And I think sometimes it may be healthy to get those feelings out and express those. And then the last myth is that you can find ways to avoid the pain of your grief and still resolve it successfully. Sometimes it's easy after a loss has occurred to try to keep yourself busy so you don't really think about it. And then people find themselves getting in a mess because they've not really dealt with the grief. And so, avoiding it is not always the best option.
So one of the big myths is that there's always that closure. It's kind of what that's been popularly labeled, is that grief always has that endpoint, that closure. And you can tell by a lot of those myths that, it's a myth. That's not the case. So there's actually a little bit of research out there on that. And therapies, in the past have traditionally focused on kind of working through the grief to reach that endpoint. And so the literature, actually says that many people do not reach an endpoint. And it's not because they're not doing it properly. It's not because they're doing something wrong. It's because some grief has no endpoint. And there's many reasons that could impact that, the nature of the event. And so that kind of leads to, that ambiguous loss. So something could have occurred and it's just impossible to understand and to, wrap your mind around that and understand that and explain that in a way that gives you that closure. And so in those cases, you may not be able to resolve the grief as maybe you thought you could or as you would like to, but that may just be the nature of that particular grief. And understanding that, and kind of the goal in therapy at that point would just be learning to be comfortable with that ambiguous loss and to kind of accept that and be able to go forward from that point. So this brings us to the stages of grief. As you can see, we've got them listed up here. There's 5 stages. We have a little video that is a little cartoonish video. This is going to kind of show us this. And the idea as far as using this video, I hope no one's going to be offended, but the idea of using this video is grief is a really heavy subject. And sometimes it can be really overwhelming just to talk about grief and to think about it. And so this video kind of takes it and puts it into a different context, and hopefully it'll let you kind of see it from an external perspective and be able to view someone else's grief, outside of that. And first one is denial. So, as the slide shows, this may look like it's not true, this can't be happening to me, there must be a mistake, all of those things that can go through your head. Sometimes you'll see the stages of grief, they vary, they'll be a little bit different. So sometimes this stage is also called shock and or disbelief. So this is usually a temporary defense, and this may soon be, replaced by the second stage and more of that. Okay, this is real. This has happened. And so the next one is anger, and this is whenever you realize this has happened, whatever your loss is, and that it wasn't a mistake. And this could be anger at yourself. It could be anger at other people. It could be anger at God. And this can look like rage and envy and resentment, and can come with some of that talk of why me, why is this happening, and just that anger about that. And the third stage, bargaining or bartering. So that's kind of the if this was to happen, if this was not to be true, then I would, I'd be willing to do this. And that's just trying to, it's like an attempt to postpone, what has happened, or that you have to deal with this situation. So, this could look like, you could be like saying, I'll give you this prize if, this is not happening right now. So trying to postpone that situation. Depression, I think we're all familiar with, what depression is. And this can look a little bit different. It can be two types. So there can be depression over the recent loss, whatever that loss was. But you can also go through the stages of grief prior to a loss if you know a loss is coming. And so that could be a couple different things. If somebody had a terminal illness, for example, you could start going through the stages of grief prior to that person dying. If you were going to lose your job or lose your home, you could start going through the stages of grief prior to that. And so you could experience that depression, depending on what that situation is. And then you have acceptance. So acceptance is moving out of depression. And the thing I see a lot in my work with clients and patients is that it really seems like getting to depression, going through those first few stages, is almost just like a natural process. It's like it just happens. And then once you get to the depressive stage, in order to get out of that stage, it's almost like it requires action of some type. Like you have to, it's almost like you land at depression, but then to get out of it, you have to do something. You have to change something in order to get out of that stage. And so acceptance is the void of depression. So you might mourn the loss less, but it's not to be mistaken for you're happy. You're not necessarily maybe happy again, or you're over the loss, so to speak, because that's a myth as well. But maybe the anger and the pain, the acute pain and stuff like that is kind of past. And maybe you've just reached that acceptance stage and you're just trying to move forward at that point. And this needs to be followed by a plan for action. So what do I do now? How am I going to move forward? So this brings us to, so these stages have been put together in what's called the Loft Cycle. And so this can include, as Jennifer said earlier, this can include any type of loss. So this can, when we think of grief, I think a lot of times, you might think of a death as being one of the main things you think of. But it could be anything. It could be a relationship ends. So, a friend moves away. A relationship comes to an end. Maybe there's a divorce, and so there's grief over losing a family unit or something. Loss of a job, loss of a home, loss of health. So just real quick example, a few years ago I started having a health issue. I was actually in a different doctoral program, and because of that, I ended up switching programs to something that was less physically demanding of me. But I definitely went through, a grieving process, a couple of things. One, the health issue, and just having loss of function, not being able to do things that I wanted to do or do things that I once could do. And then also, kind of the grieving process of the fact that it led me to change my career path, which, a lot of work goes into planning anything that we do. And so, I kind of went through that process with that as well. And, everything, overall I really wouldn't change much, but definitely went through those stages. So that's just another example of grief outside of an actual, death. And lots of activity, previously. So right now we're going to go on with diversity issues with death, dying, and grief. And like we said earlier, it's so individual. We grieve differently based on what we've experienced, how we've seen our families grieve, and cultural factors as well. So whatever, is going on in our culture. So as therapists, we definitely want to be sensitive to all of those issues when working with somebody with grief, but also as, friends and family of individuals, it's good to be sensitive to those things as well because, like, for example, you're wanting to be supportive of your friend, and, she may view grief differently than you do, maybe based on some of these factors. And so you definitely want to be sensitive to those things. And they vary depending on lots of different factors. Culture, ethnicity, religious beliefs, all of that stuff kind of goes together. So we picked out 4 different ethnicities that we're going to talk about and kind of give you some details about what is typically done within those ethnicities and those cultures. Now keep in mind that there is also variability within any culture, and so this is definitely not going to be the same for every person. So the first one is European Americans, and so post-death ceremonial bereavement practices, gatherings at the home of the deceased. This can happen, whenever people learn of the death. It can also happen after a funeral. Food is typically provided at these gatherings. Also, European Americans tend to depend on either funeral directors or clergy to kind of help facilitate and help guide and make decisions as far as funeral arrangements, making those preparations. There's typically a visitation or a viewing prior to a burial, typically at the funeral home. Sometimes that may be in a church or something. Funeral services are typically after a service at the funeral home. There's typically at least a brief graveside service. And the funerals tend to be rather subdued. And so this has kind of been viewed as, I have experience with a training video in this area. One of the things that they point out in looking at these different cultures is that the European American culture seems to be subdued in that some of the other cultures have more of a celebration of life. They're maybe more joyful, whereas European Americans is a little more subdued. Dark clothing tends to be worn at the ceremonial services. However, in recent years, this has shifted a little bit, and so more colorful clothing is being worn. And this is kind of to change that atmosphere of kind of moving more towards that celebration and hope and that sort of thing, rather than just kind of focusing on the negative.
Yeah, but when I went to the funeral, his case, he was kind of depressed, and so he knew that he wouldn't live he was just a depressed guy, I think. And anyway, he goes, if I was to ever die young, don't grieve for me, celebrate my life. And he didn't want nobody showing up at his funeral in dark clothes, and he wanted street clothes, their normal selves. And
so he made that well known, what he wanted. And is that what happened at the funeral?
Yes.
Yeah. Mm-hmm. So people respected that.
Yeah.
So, and that's good when people talk about what they would like, because of course you're more likely to get what you want whenever you let people know what that is. But there has been a shift in that European American a little bit.
And so the next one we're going to talk about is the African American culture. And very similar to the European American culture, the funeral director is highly involved in the funeral and the burial arrangements. Most of the time they'll have some kind of gathering of friends and family at the home of the deceased, and that's to offer support and, to share in that common grief that they're going through. They will also have a wake, and at this point that's when they'll have music and songs and hymns are usually played or sung. Then some African Americans will hold what they call a homegoing service. And that usually it reflects the personality of the deceased, and it celebrates the conviction of going home to Jesus and kind of being reunited with past friends and other relatives. And then they'll have a shared meal among the grieving loved ones after the wake or the funeral usually. And then for the funeral and the burial, a funeral service is often followed by a burial. And in the African American culture, a lot of times you might see that cremation is less accepted. And so generally you won't see that practice by them. Again, that's not across the board, but usually. And sometimes if the family has a deep religious faith, The church observances will likely be integrated into the service as well. And then African Americans, they often express grief at death with the physical manifestation of great emotion. And so, you know, not to say they grieve more or more intensely than any other culture, but they seem to have those greater display of emotions sometimes. I know I've been, not to very many, but I have been to an African American funeral, and I had never witnessed at a funeral before people would display so much strong emotions, and so that was really different than I was used to. But not to say again that they grieve any harder or more for their loved one. And then they also have a concept they call the living dead, and this basically refers to the people who died, and then their spirits kind of live on in the memories and the thoughts of those still living. And so that's what that is. And then the Latino Hispanic culture, most of them, but not all of them, practice the Catholic faith. And then even if they're not regular practicing their Catholic faith, they will a lot of times do it when it comes to death and dying especially. And in their culture, the priest is highly involved in the funeral planning. And then they have what's called the Day of the Dead, and that picture is actually that you see is where they kind of get all dressed up, and they kind of have a big celebration, a big festival of the loved ones that have gone on. And then they try to, you know, they want to normalize death and make it okay, basically. And then they have the importance of the rosary. And in the rosary, often it's at the home of the deceased, the rosary is said by the ones that have survived. And in a lot of Hispanic groups, the rosary is said every night for 9 nights after the death. And then in some families, you may see that the rosary is said every month for a year after the death. And then it's repeated on the anniversary of that loved one's death, rather. And then you'll have the funeral services. They're often included in Mass because it is of the Catholic faith a lot of times. And in the family involvement, loved ones are encouraged to express their grief, and many of them are involved in the procession to the grave. And then in the Hispanic culture, a lot of times the survivors will commemorate the loss of their loved one, and they'll make promises and commitments. And if you don't keep those promises, which they feel is very serious, they feel like it's considered a sin. And so that's basically what the Hispanic culture adheres to. And then for the Asian culture, a lot of times, again, they'll gather at the home, gather at the funeral home, rather, to make the arrangements. And then in the Asian culture, the family elders assume most of the responsibility for the ceremony. They will dress the body in warm clothes, and then they'll use watertight caskets because they want to show great respect for the body, and they want to keep all those elements out. And then you may have stoic attitudes are often common. You may see some depression that result from how they internalize the grief as opposed to acting out kind of behaviors. A lot of times they'll have an open casket, and that just shows respect for the elders. And they will even sometimes write poems in calligraphy that are left for the deceased after they're gone. And then in some Chinese American cultures, they will have a cooked chicken, and what they will do is they'll place it by the casket as the last meal for the deceased and the spirits. And then once they go to the burial, they will bury the chicken with the body. And then a lot of times music is played, and a band may wait outside the funeral home and accompany the procession to the cemetery. They may burn incense at the grave, and in some populations, sacrifices are even made at the funeral. And then the funeral route and the burial location and the choice of the monument are all really important to this culture, and they're very specific about those kinds of things. And then they'll have a gathering of family and friends for a meal after the funeral, and that just shows respect for the spirit of the deceased, and it gives thanks to those who came to pay their respect. And then a lot of times they will have a picture or a plaque that they will display in their home, and along with some other things, maybe of that loved one, and just kind of create a shrine for them after they've gone on.
So the Native American culture, so they learn about death by looking at the natural world. And so they see, that the trees and the animals die, and so death is considered to be a natural passing. So something different with their culture is they don't actually recognize just an immediate family. So every person is born into what they would call like a clanship of the mother. And so each person plays a different role. They don't believe in heaven, hell, or the devil. Therefore, their spirituality and religion is not fear-based. Death and dying is a priority over the material world. And as a result, members of this culture, they will often quit jobs and schools in order to be with family members who are ill or who are dying. And so, each tribe is very distinct. People tend to stereotype all Native Americans into a single group, and there's hundreds and hundreds, thousands probably of tribes. And so they're all different. They all have their own distinct culture, and there can even be differences within a particular tribe as far as what cultures are actually practiced, etc. And so years ago, Native Americans were very traditional. They had a lot of knowledge about their people's traditions and culture and their language and all of those things, and they passed that down from the elders to the other members. But since they were moved into reservations and they have been acculturated, a lot of Native Americans no longer know their native language and a lot of their native traditions. And some new traditions have been started. There's some things that are kind of viewed as being traditions that were actually started once Native Americans moved to the reservations rather than prior to that. So as far as grief and that type of thing and death, there's numerous healing rituals that they practice. These can include spiritual leaders, medicine men, who may do things that other cultures don't do and other cultures don't understand. This can create significant barriers for this population, especially if they have a loved one in a hospital setting, or they're trying to access medical care in the world of today, and they're still trying to keep with their traditions and their values. They may, since they don't recognize that immediate family, they typically at a bedside of somebody who's dying, there would be lots and lots of members of family, extended members of family who are all considered family, just as we might consider the nuclear family. And that's not typically allowed in hospitals, not typically viewed as being, the appropriate people to be in the room and that sort of thing. So that can create some barriers for them being able to deal with grief and death and dying in a way that fits with their values. So this brings us to some interventions. Touched on this a little bit ago. So, we're therapists, so of course we're going to say therapy is wonderful. Of course we believe that, or we wouldn't be doing what we're doing. I've actually, one of the things that, I was interested in this topic before, but when I started doing therapy, my interest really peaked because I was astonished at the number of individuals that I see that have some issue of unresolved grief of some sort. And most of the time, maybe 70% of that, something like that, is due to a death of a loved one or friend or something like that. But I also work with a lot of people who are homeless, and so a lot of times there's a lot of grief involved in losing your home and your family and, you know, a lot of things that come with that. But I see it so frequently. And when I look at, you know, my bigger world, I see that, you know, a lot of times grief is not, you know, in the culture that I've been a part of, it's not discussed a lot. And so you kind of learn, you know, I've learned personally from grief just by, you know, the people I've seen grieve or people I've seen not grieve, and kind of just bury those emotions, that sort of thing. So therapy is a great place to process this. And I've worked with individuals who, you know, lost parents when they were 6 years old, and they're now 50 and still grieving that loss. So that goes to that myth of the timeline. There is no timeline. And, you know, the more you keep those emotions buried and you're not, you know, working through that, that timeline can definitely grow. And, you know, because this, you know, a lot of people, they don't know what to do with this. I mean, it's tough stuff, and we don't know what to do with that a lot of time. Therapy is definitely some place where you can go where, you know, your therapist is going to know kind of how to deal with this and how to handle this and help you work through that process. Not to say that everything's always going to be all better and all of that, but it can provide support for you to kind of process, you know, what you're going through. And flooding is a technique that can be used by some therapists, and that's just really going through, you know, whatever you experienced and going through that a lot to where it reduces kind of the negative feelings associated with that after a while. And so then, and some of those activities that we give you, I've used all of those with patients and clients. Like I said, the Loft Cycle, I'll ask them to identify where they at. Most people can be like, you know, we already kind of know what, unlike in here, you know, I already know what their loss was. And so they can, I mean, they look at that and they're like, I'm here. Or, yep, I've done all this. And, you know, people usually know. And that's been my experience with that. And I've also used the, you know, there's that myth of closure that we talked about. Some people, you know, people like closure. It'd be nice if everything could be neatly wrapped up and it's like, okay, this is all done with. That's not realistic. But there are, you know, I think about, they just, you know, people can kind of move to a place where they're more comfortable with that grief. Not to say that, you know, it goes away, but just where they're more comfortable and where they feel like they can handle it rather than it being completely overwhelming and depressing. And I've used a lot of those techniques on there. I actually had a patient once who bought a plant and named the plant after the individual, and that worked for that person. So, you know, there's lots of different things that you can do those particular days of, you know, that are difficult. You can pick some of those.
They have to go back and decide who they are now, because they were always Bob's wife or, you know, Jan's mom or whoever, and they have to change who they identify themselves as. And they have to sometimes take on their own life because they've basically been living someone else's.
It definitely happens. And sometimes your identity is wrapped up with your roles. You know, your mother, you know, you're a mother, you're a child, you're, you know, various roles that you have, and with various people. And so
I see this with a lot of our older folks is that they've outlived their brothers and sisters. They've outlived some of their children. They are separated from their, you know, grandchildren and all that. So who are they now?
Right.
And they're, you know, struggling because they cannot figure out which pocket they put themselves in.
And that can be part of the challenge, is not only dealing with a loss, but figuring out who you are, how this impacts you, how this changes you, and where to go from there. Another thing that, you know, that you often have to deal with is, you know, comments people say and that type of thing. And, you know, sometimes those are helpful, sometimes they're not helpful. I think one of the things to keep in mind there, most people intend to be helpful, and when people say things, they're typically trying to be supportive in the way that they know how. That's why it's always great to be aware of, how somebody feels about particular things, so you don't say something that's real offensive to them. There's lots of things we consider in therapy, ways to increase sensitivity to diversity. We look at whether, especially if we're working with somebody who's in maybe not the majority culture, like one of these cultures that we talked about, whether they are acculturated, whether they have more traditional values that they're living by. We definitely want to consider those. Identifying support systems, that type of thing. And then recognizing that family and community play a role in caring for people, and that type
Also,
of
they
thing.
need to have a sense of purpose and usefulness. My grandmother would say, all I do is sit in the chair and watch the cars go by, and I count them and see how many are blue.
Mhm.
And because basically she was older, she was on her last days, and she said, I can't contribute anymore. I can't make a meal. I can't, physically do anything other than just be here in the moment. And I said, Grandma, sometimes that's all you need. You're here because you need to be here for this purpose. And I said, if I have a question, I can ask you. You don't have to get up and do anything. You don't have to go anywhere. You don't have to do, you can help me work through this issue just by your experience and what you know.
But that's, that's true. People, if they don't feel like they have a purpose, then it definitely makes things difficult as far as that goes. So just kind of in summary, individual factors influence grief, your experiences, losses that you've suffered before. It's like we said, they impact you, they can change you, so all that. The way you respond to one situation at one point in time, and the way, even if it's a very similar situation, you may respond a little different at another time. Additional factors that can influence that. So your gender, there's some information out there that, men and women, kind of tend to do some things differently. So, of course, we're going to, maybe respond to grief differently as well. Age, Jennifer hit on that earlier, as far as with children, it's very different.
And for me personally, when I was 15, I lost a grandmother. And then at 25, lost my grandfather, who was the mate to my grandmother. And those were two totally different experiences. And it was, I couldn't understand personally, why is this so different than it was, 10 years ago? And it wasn't, I think it even made it harder because I felt like I grieved more when I was 25 than I did at 15. I felt like I bounced back faster at 15. And then so when I was grieving more at 25, I almost felt guilty because I was like, what's wrong with me? Why didn't I grieve this way when my grandmother died? It didn't make sense to me. So that was really hard, and I can see how gender would play a role in that. And
age, too.
I mean, age, sorry, not gender. Age,
as a child, you may not even understand, maybe the permanence or how that's going to impact your life, but at 25 you might definitely do that. So we kind of want to leave you with this quote.